Welcome everyone, and thank you to those joining us live and to those listening it afterwards. We hope you all are doing well and excited to be part of our discussion today. I also would like to warmly welcome our speakers and panelists for being with us today. I'm Shirley, and I'm currently working in FIP as the FIP Data and Intelligence Specialist. It is a pleasure for me to be here to moderate this important discussion on the role of early career pharmaceutical groups in global health. As part of the health workforce, we, pharmacists and pharmaceutical scientists, play an important role in global health activities. And as a global body representing over 4 million pharmacists and pharmaceutical scientists worldwide, FIP Vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technology. Our mission is to support global health by enabling the advancement of pharmaceutical practice, science, and education. Leading by the young pharmacist groups within FIP, we are pleased to be delivering this event, the role of early career pharmaceutical groups in global health. Today, we will be sharing key findings for the global survey on the role of early career pharmaceutical groups in global health. We conducted this survey last year, and we would like to also thank to everyone who has participated in this survey. Today, we will also hear from some national YPG representatives on their innovation and activities in global health. And lastly, we are aiming to identify areas for development in global health and opportunities to advocate for early career pharmacists and pharmaceutical scientists in your region. So please join us in this discussion. So before we begin, please note this event will be recorded. It will be also live streamed on FIP YouTube and will be available at our website as well. You may ask questions using the Q&A box, and we will be picking those up throughout today's session. You are also welcome to provide feedback to webinars@fip.org. And if you haven't done so, we would like to encourage you to become a member of FIP, and therefore FIP YPG if you are eligible. Here you will see criteria for being FIP YPG members. There are so many opportunities that you can get within the FIP YPG. So I would like to encourage you to join us by connecting to this link, www.fip.org/joinFIP. Okay, let's move on now to our session, basically. So I would like to now introduce my colleagues who is amazingly leading this project and this global report. Welcome, Raquel Oliveira. She's a member relations subcommittee of FIP YPG 2021. And although in her busy professional life, working as a hospital pharmacist in Loures near Lisbon, Portugal, she is still able to manage her time in leading this important project. She is such a superstar. Welcome, Raquel, and the floor is yours.
Thank you very much, Shirley, and thank you for that introduction. Welcome all, and thank you for being here. So this is our panelist for today. Unfortunately, Onyeka won't be able to join us because he's having his PhD exam, and we wish him a very good luck. In the next slide, please, Shirley, we can see the authors of this report. We have been working on this report for the past 10 months, more or less, and I would like to thank them all for all their commitment, all their efforts, and all the help they've been giving in this report. And we also, all of them will be talking today. So, and we welcome you to please save your questions and your comments to the panel discussion in the end. And next, we would like to welcome Dr. Paul Sinclair, and if possible, we would like him to say a few words about this report. Dr. Paul, I think you are here with us.
Thank you. Yes, thank you, Raquel. Thank you and welcome everyone. And it's a great pleasure for me as the chair of the Board of Pharmaceutical Practice at FIP to be part of this launch today on what is truly a very significant report, the role of early career pharmaceutical organisations in global health. I think more than anything, it shows the potential and the power of young pharmacists and early career pharmaceutical organisations. The report has a wealth of information and data, which I'm sure will be a very, very valuable resource to young pharmacists, early career pharmacists, as well as early career pharmaceutical organisations. We see in the report direct links to the FIP development goals, in particular to development goal number 2 and 6, plus a number of others. And that aligns very, very well with the notion of one FIP. And since the launch of the one FIP mantra, I must say that the engagement with the FIP Young Pharmacist Group has been very, very important to FIP and has been instrumental in delivering a lot of the relevance that's now attached to those development goals. So I would just say quickly, congratulations to all involved. Particularly to the project team and the authors. You should be very proud of what you've done with this work. There is a huge amount of work that's gone into it, and reading a draft of the report and seeing just the amount of data that was collected and the response from the various organisations. It is a credit to all of you. And I can tell you that at FIP, we look very strongly to young pharmacists to be part of discussions and to be at the forefront of advocacy and policy development. And I can see that with this group in particular, we are very well placed to continue that discussion. And the future of young pharmacists looks very well assured in the hands of those who are part of this project. So congratulations to you all.
Thank you very much for your kind words. So for today's agenda, we will go through every chapter from this report. We'll start with chapter 1, Global Health Challenges and Opportunities. Then we'll go to chapter 2, Youth and Global Health. In chapter 3, we'll present the results from this global survey on the role of early career pharmacist groups in global health. Then in chapter 4, we'll have the authors of the case studies from Indonesia and Malaysia to present their own case studies. And then Renly will present to us the way forward. And in the end, we'll have this panel discussion. So please feel free to write your questions in the Q&A box. And in the end, we'll join together in discussion when we talk about this theme. So to start in the chapter 1, we have a background of the global health challenges and opportunities, which gives the context for this report and the role that pharmacists in general can have in global health. The global health is defined as an area for study, research, and practice that places a priority on improving health and achieving health equity for all people worldwide. And the Sustainable Development Goals were created in 2015 to be achieved by 2030, and they aim to promote prosperity while protecting the planet. By September of 2019, it wasn't necessary to create this decade of action, and the list of 13 global health challenges were created to speed up and scale up the progress towards achieving the 2030 agenda. We also talk about epidemics and health emergencies and how pharmacists tackle these emergencies that we are now facing with the pandemics of COVID-19, but also the epidemics of non-communicable diseases like we face every day. Talking about global health is also talking about primary health care. And so here comes the Standard Declaration, which emphasizes the role of primary health care in achieving global health. Pharmacies have played a major role in this topic, so we could not mention it. The 5th development goals relate with all of these topics, and they were launched in 2020, and they are set to transform pharmacy and pharmaceutical science in alignment with the United Nations Sustainable Development Goals. So now my colleague Fumbi will talk about the chapter 2.
Thank you, Raquel, for that wonderful talk on chapter 1. So my name is Funmi Okoya. I'm a current master's student at the Harvard School of Public Health, former chairperson of public relations for FIP YPG, and I'm currently the YPG liaison to the FIP Foundation. Okay, straight to chapter 2. As you probably already know, the world currently has the largest population of young people in its history. More than half of the world are under the age of 30, and that kind of lets us know that youth have a very important role to play in the world today. And as the pandemic has even shown us, most of the frontline workers have been young professionals who've been working really hard to address most of the, not just the problems caused by COVID, but also the indirect issues that have been caused as a result. And we can see that a lot of organizations are recognizing the role that young people have to play in global health. And we can see with, for example, the United Nations, who established the Youth Strategy 2030, working with and for young people. We can see also the World Health Organization's Global Health Workforce Network, the set up the Youth Hub, which is kind of an interprofessional collaboration from healthcare workers, youth healthcare workers all around the world. And of course, we have FIP YPG, which is the youth arm of FIP. And to focus on FIP YPG, Shirley already gave an introduction to FIP YPG. But we can see that FIP YPG has been playing significant roles in global health, starting with leadership development. FIP YPG has been at the front of this, trying to develop pharmacists and pharmaceutical scientists all around the world with the leadership development workshop at the World Congress. We also have a lot of professional development and mentorship activities that are carried out all year round. We have the mentorship program, we have the volunteering program, and we put in a lot of information for career development through activities and events that people around the world can benefit from. Particularly, we play a very significant role in campaigns on World Health Days. And this is really important because as YPG is at the forefront of pharmacists globally, we work with and encourage all other national pharmacy, youth pharmacy organizations to also try to campaign and communicate, advocate for health in different areas, particularly. Also, YPG plays an important role in encouraging innovation through scholarship and grant. Particularly, we have the YPG Grant for Professional Innovation, which is sponsored and funded by the FIP Foundation. And this goes a long way in ensuring that pharmacists can really contribute to global health in their local practice. And finally, we have different publications on global health issues that are always input. That we had one on mobile health, and this is another one that we're having on how early career pharmaceutical groups are playing important roles in global health. So looking forward to YPG playing more significant roles in global health, and I hope everyone will try to get involved in these activities and contribute towards that universal goal. Okay, that will be all from me, and I would hand it over to Renly to talk to us about chapter 3.
Hello, everyone. I'm Renly. I am the current FIP YPG president. I am also a research fellow. I'm based in Adelaide in Australia, and it's almost 9 o'clock here. So I think everyone is probably a lot more interested in the results, what we found, and also our panel discussion at the end of the session. So I will try to keep this short. A lot of this information will be available, so the methods, everything will be available in the whole entire report. But basically, this survey was the first global survey which aims to understand the activities related to global health that was undertaken by individuals and groups of pharmacists and pharmaceutical scientists from different countries. The figure illustrates the survey process. So we explored 4 components, including the programs, initiatives, expectations, and perceptions, and everything the survey aligns with fit building goals. So the next slide shows the questions were pilot tested and reviewed by FIP leadership. We disseminated the survey between July and October 2020. We promoted via social media and MailChimp, and we analyzed the data according to one of these 4 categories of interest, which were challenges, goals, and roles, emergency preparedness, and programs, youth initiatives, and early career pharmaceutical organization initiatives and programs. So I won't go into detail because my colleagues later on will explain will share some of the results of survey findings. Next slide. So this survey, we targeted 3 types of respondents, and we grouped them for clarity. We just grouped them into 3 groups. So group A were individuals who didn't have any early career pharmaceutical groups in their country, so they were responding as individuals. And then there was group B, which were individuals who they had ECPG in their country, but they weren't responding on behalf of the organization. And then group C, these were individuals who were representative of their early career pharmaceutical group. Next slide. I think I'm handing this over. Yeah, sorry. This is the results. So in group A, we had 28 survey responses from 40 people, 28 countries. Group B, 33 from 18 countries. And then group C, at the bottom row, you can see that we had respondents from 20 early career pharmaceutical organizations. I think I'll hand over now to Diana to share the survey results. Thank you.
Hi everyone, my name's Deanna and I am a pharmacist in South Australia, like Renly. I am the Young Pharmacy Group Hospital Pharmacy Section Liaison, and I came on board this project to help with some data analysis and also finalising the report. So I have the exciting job of sharing the first lot of results with you from Chapter 3, and that's on the challenges, goals and roles of early career pharmaceutical groups in global health. So as Paul mentioned, there's a lot of data in this report and a lot of really useful information. So I'll just give you a very quick summary. So the first section that I'll talk about is the Sustainable Development Goals. So that's the United Nations Sustainable Development Goals. So there's 17 in total, and respondents were asked which of the Sustainable Development Goals they wanted early career pharmaceutical groups to contribute to, which ones they were contributing to, and then which of these goals they were contributing to. So there was a little bit of variability, but all in all 3 groups had Sustainable Development Goal, good health and well-being as a priority for initiatives and where initiatives were actually already occurring. Next, there was quality education, Sustainable Development Goal 4, industry, innovation and infrastructure, which was Sustainable Development Goal 9, and Sustainable Development Goal 17, partnership for the goals. So it's not surprising that these are the Sustainable Development Goals that respondents wanted initiatives in and that we're already contributing to, because these are the ones that relate quite closely to healthcare and obviously to pharmacy practice, being that we're in the business of good health, but also that we need quality education to be able to do our roles. And we need a sustainable industry to be able to design and develop drugs and then utilise them appropriately. So some other results from that section were that individuals weren't always aware of the initiatives that the early career pharmaceutical groups in their country were involved in. So they might need to be a bit more awareness there. And the least selected out of the Sustainable Development Goals were life below water and life below land. And that's not really surprising because they're, I guess, some of the Sustainable Development Goals that don't directly relate to pharmacy and healthcare. So the report goes into a lot more detail about the regions and some of the initiatives that were actually happening in the regions. So I would encourage you to go and have a look at them if you want some more information when the report is available to you. So the next section I'll talk about is the urgent global health challenges. So these were the 13 challenges that we need to achieve by 2030. And here, there was a bit of variability between the individual respondents with and without early career pharmaceutical groups and also the pharmaceutical groups themselves. So all groups thought that expanding access to medicines was something that we should be working on, and it was also something that organisations were working on. And then after that, stopping infectious diseases and preparing for pandemics was something that individuals were aware that their young pharmaceutical groups were working on, and also that these organisations actually had initiatives in. Again, this isn't surprising. It's at the forefront of everyone's mind, given that we're living through a global pandemic at this point in time. Then with the other goals, it was a little bit variable whether people wanted us to work on them and whether we were. So most regions expected, most individuals expected us to work on these things as early career pharmaceutical organisations. And across the region, some of them were actually having initiatives in all of these areas. So again, there's more detail in the report about each of those challenges and some of the initiatives that are occurring. And I encourage you to go and have a look when you have the opportunity. And last but not least, for this section, we have primary healthcare. And this is a reflection for our commitment to the Astana Declaration. So about a third of respondents expected initiatives to be led by our early career pharmaceutical groups in this area, and expected these to be interventional and also advocacy type initiatives. About a third of the respondents said that their young pharmaceutical group had led initiatives in primary healthcare. However, some countries had organisations that were leading initiatives in this space, but the respondents in those countries weren't actually aware of them. So again, there's a little bit of an awareness issue there. 40% of the organisations were leading initiatives in this area. So that's great to hear because we're actively working towards our commitment. And again, there's more examples and detail in the report. So I'll now hand over to Shirley, who will continue to go through the results for us all.
Thank you, Diana. Okay, so now let's move on to the next part of the result. So this picture basically shows some emergency situation happening in the world recently. You can see here, we have fire, we have earthquake, we had flood, we had drought, and many more. It's all over the world. And if we think about ourselves, what can we do as pharmacists and pharmaceutical scientists? How we, as early career professions, can contribute to this. And this is also another emergency that we already know as well. It has been almost 2 years. We are living in this global pandemic time. This picture actually was taken from the WHO COVID-19 dashboard. And as we can see here, as per 5 August, there have been like 200 million confirmed cases. And some countries recently have second wave and third wave. And how do you feel about the role of pharmacists and pharmaceutical scientists here? And as we know as well, the role of pharmacists actually varies between, like, for example, giving proper information and medication management, and also in developing the vaccine. And again, if we think about how early career professions as individuals and early career group can contribute. And that's something that actually we are trying to find out in this report. And as Diana mentioned as well, in this report, we also have a section related to the focusing more on the pandemic and also focusing more on the national preparedness program. Okay, so this is basically the first part of the national preparedness program that we have in this report. We are exploring if the individuals or organizations are aware of national emergency preparedness in the country. And actually, interestingly, 25 out of 48 countries, which is around 52% of countries, do not have emergency preparedness programs. This is based on the early career professions perception. What does actually mean to us as early careers? This can mean that not many early careers outside aware about the emergency preparedness of their country. But again, our result actually limit with the small number of respondents that we have. But this is still, we still provide a lot of results inside this report. So I would like to also encourage you to still to read this report basically. The next part of the report is about, it's covering early career groups related to their expectation and involvement. focusing on the emergency preparedness. And here basically are some of our findings. As you can see here, we discovered that organizations are involved in the advocacy planning and awareness session, and mostly their involvement through this activity. We also discovered that respondents highlighted a need for more involvement of early career groups in emergency preparedness, particularly related to the policy development. It is important to highlight this because we know that meaningful engagement of youth in the policy development, this is actually encouraged by many global organizations. In FIP itself, YPG is also being included in any FIP work stream, which is one of them is actually we have representative in FIP COVID-19 Hub. Also, specific for the COVID-19, we also have a section here basically which talk about some involvement that are mentioned by some early career professional groups during the COVID-19. And if you can see here, basically we have some success story from Algeria, from Tanzania, Lebanon, Pakistan, Taiwan, Australia, and Malaysia. So in summary, this is basically what we cover in the National Preparedness Program, which is we identify their perception related to the National Emergency Preparedness Program in their country, and also from the early career professions perception, and also related to the COVID-19. And I would like to encourage you to read the report in detail because we have a lot of findings. So we also have across regions as well. And I will now hand over back to my colleague, Raquel, to follow with the rest of the results section of this report. Raquel, the floor is yours.
Thank you, Shirley. So in chapter 3, we also analyzed the youth initiatives, expectations, and involvement in 4 different topics: policy and regulation, general services, specific services, and condition-specific services. In this part of the survey, it's very important to take in consideration that we always analyze the involvement of the current involvement of the responders versus the activities which the responders expect early career pharmacist groups to be involved in, to lead on. So in policy and regulation, the major part of the responders, the individuals, currently do some activities in drug formulary development, prevention and safety programs, and they expect early career pharmacist groups to be involved in professional programs as well. In general services, the expectations of individuals match the activities led by early career pharmacist groups, especially in dispensing of medicines, patient counseling, research and education, and public health campaigns and health promotion. In specific services, those were the top 4 activities which early career pharmacists are involved in: antimicrobial stewardship, health screening, smoking cessation and alcohol use, and TDM. And in these specific services, early career pharmacist groups have plenty of activities, which is interesting, and it matches the individual's expectations. In the condition-specific services, diabetes, asthma, and hypertension management are the most common services that individuals provide activities on. Also infectious diseases and pain management, which goes along with the activities that early career pharmacist groups develop. But at the same time, it was interesting to find out in these condition-specific services that mental health is a topic that individuals expect ECPGs to lead activities on, but currently not so many groups have activities in this topic. And this can be an interesting point to talk about in the future. We have a lot of results in this part of the survey. And if you want to get more information, I really encourage you to read the report. And if you have any question, get back to us. And now my colleague Lucas will talk about the early career pharmacist groups initiatives, activities, and engagements.
Thank you, Raquel. Let me talk about these 2 specific points. So when we think about the activity and how the youth perceive the work of those organizations, it's important to divide in 2. So we have, of course, the group A, the one that does not have organization in their country compared to the B and C, so the ones that have one or in their country or are speaking on behalf of their country or country's organization, we see this difference. So those who don't have an organization, they are looking, they expect that if one organization starts to exist, that will support them with career development, leadership development, so their abilities and their skills, and also the development of their own careers. While for the other groups, the ones that already have, they have a focus much more on developing the webinars, developing new partnerships between the youth and the other organizations, and creating activities so they can network between them. Why this happens, of course, could be an entire research only on this, but our perception is that for those who don't have, they are looking on this on the organization, but for the ones that have organizations, they already receive it. So this can also be seen for FIP and YPG and FIP, that we provide this kind of activities that on leadership development, on mentorship. So we believe that this difference of interest and the perceptions that they have are based on the fact that those groups, they actually provide it to themselves. But the group B and C, they are interested on this partnership. So it comes for us for the second image that you have there. That is, we observe that the youth is working together strongly with other NGOs similar to them. So it can be also FIP, for example. They're working with the pharmacists and with the university, mostly with the universities. So for those who are really early career, they are leaving the university, but they have a minor support together with patient organizations and caregivers, showing that they go more together for, okay, those who are on the same area, but not so much with those organizations and individuals who work together with the patients themselves. So this is a very interesting difference that we see that can support the organizations that will arrive and the ones that exist to think about how they will engage with the society. For the next slide, we will see the information on the case studies. Please. So to open the fourth chapter, and before passing to my colleagues, we received from the group C, so the ones who spoke on behalf, who answered on behalf of their organizations, we could receive from many places. The only one that we unfortunately missed was the Pan American region, which does not mean that they don't have those organizations there. We even know that they actually exist, but unfortunately that we just did not receive their answer on this specific report. But for the others, we selected those 5 regions and 5 organizations to talk on the report about what they do. And we can see a great variety of what they do. So we can see from the advocacy, policy to, so on this more, let's say, policy making level. But we also have those who are working hands-on the emergency response. So for example, Lebanon, with the crisis that they had, and also for the African continent together with Nigeria on the COVID. So, but then for today, I want to invite you to listen to my friend Anggun, who will talk about the Indonesian case study that they share with us.
Thank you, Lucas. Hi, everyone. I'm Anggun from Indonesian YPG. Well, we submit 2 case studies for FIP YPG, but we decide to present our most acclaimed program in IYPG. The theme is about emergency preparedness with the title Pharmacists Disaster Response, or in Bahasa, we call it Apoteker Tanggap Bencana. So for short, we call it ATB. Again, IYPG is an organization dedicated to accommodate Indonesian young pharmacists under 35 years old. And we also serve as a legal organization under the umbrella of IAI, or Indonesian Pharmacists Association. Since it was founded in 2012, IYPG has been independently formed in 17 provinces in Indonesia. We are conducted various programs, include social service, health campaign, and the ATV. Next slide, please. Okay, here I tell you the fact that you probably already know, that Indonesia isn't foreign with the various natural disasters. And in the 2018, when the ATB program was first initiated by IYPG West Java chapter, Indonesia has been hit with some fatal natural disaster, such as tsunami Banten and Palu, and also earthquakes in Bali and Lombok Island. In Indonesia, we have a national agency who focusing handle disaster management in national and regional level. We call it BNPB or BPBD. But at that moment, IYPG still saw the need for professional pharmacist service in the disaster area. Some service like management and distribution of medicine and medical supplies, maintaining health records and stuff. And that's the primary reason we built the ATB program. Next slide, please. Okay, so the training is a collaboration between IYPG West Java chapter, IAI, and also BPBD for 2 days in April 2018. So at the time, it's the first national scale with the total participant join are 85 pharmacists, with the 65% is a young pharmacist. The objective were to form a cadre of a pharmacist for disaster response, where pharmacists not only helping in their professional service, but also can hone their altruism in responding the emergency like first aid, building the tents, rescue, evacuation, and also communication skill to related parties in the disaster area. And it was 2 days training combined with the theory and the practical training. First day or day one, the participant learn about disaster management, motivation to become a volunteer, sharing session, and build up emergency tent. And the second day, the participant learn about water rescue and also vertical rescue, as you can see in the picture. And all the participants were inaugurated as the first batch of a pharmacist ambassador on disaster response. Oh yeah, in the early training, the module was created with the reference from our National Disaster Management Agency and also a guideline for pharmacy from FIP for responding to disaster guideline. Next slide, please. Okay. Since successfully conducted in 2018, the pharmacists who passed the ATB training was actively involved in emergency response in their local area. Now the ATB program adopted in more than 5 provinces local chapter with the highest disaster frequency. ATB program also had lots improvement with updated on module and syllabus and divided into 2 types of training. There's a beginner and also advanced. Next slide. Because the ATB program counted as one of the most acclaimed and successful program conducted by Indonesian YPG, today ATB is also legally recognized by IAI, Indonesian Pharmacists Association, as the latest affiliate organization in the association, who focusing on humanitarian and disaster field. Thank you. We'll continue by my fellow Malaysian pharmacists.
Hi, everyone. Hi, this is Cedric. I hope you guys are doing well. I'm from the NPS Young Pharmacists chapter, which is from Malaysia. Today, I'm joined by my colleague, which is Theo, who will continue for part 2. So we're doing it in 2 parts. I'll start first. So the theme is basically advocacy, welfare, and job satisfaction. And for background, I mean, essentially this project is essentially a survey to look into the job and training satisfaction, as well as the welfare of government contract pharmacists in Malaysia. But let me give you some background to this issue. So in 2016, the Ministry of Health of Malaysia, which is the largest employer of early career pharmacists, they decided to start a contract employment system to reduce the number of pharmacists on permanent employment. So as a result, not only do contract pharmacists have to contend with lesser positions and openings, they also had to navigate various challenges. And the prime of all is, of course, the irregularities in a brand new system. And that's what this survey set out to achieve, and of course, to collect proposals and suggestions for the betterment of the system. Next slide, please. Thank you. So some information about the survey. So it's run between 8 to 14 June 2020, was last year. And we targeted this survey at two main groups. The first is, of course, the contract PRPs, or we call them the provisionally registered pharmacists. And in short, basically these are the early career pharmacists who are in their first year of training, or rather we call them the first year trainee pharmacists, and they are on provisional registration. And the contract PRPs, the contract FRPs, will be the fully registered pharmacists. And these are the people who are on either their second or third year of service. And these are the people, of course, they are on full registration, but all of them are in fact on contract with the Ministry of Health. Next slide, please. And we did this, of course, through a questionnaire and, of course, an open feedback section to ensure that people could give more, like constructive feedback. And it was conducted via Google Forms. It was publicized through social media, primarily via Facebook and WhatsApp. Next slide, please. So we looked into 6 key interest areas to which there were contention. First one is, of course, next slide. First is the consistency and earn time off, or what we call in short ETO claiming. So in this section, what we tried to look into was to explore whether contract pharmacists were refrained from collecting or receiving their earned time offs for performing some of their instructor duties outside of office hours. Next slide. Second is, of course, duration of consideration for permanent recruitment. Now, in this section, we tried to explore, we tried to seek the responses of respondents, whether they would agree that consideration for permanent employment should be based upon their performance in 2 years of service instead of just the first year. Next slide. Third is the lack of training opportunities. So in this section, we tried to explore if contract FRPs were deprived of training opportunities compared with their permanent counterparts because of their unfavorable status. Next slide. Before is performing unwanted duties. And this section, we explored if the contract FRPs, whether they were instructed to perform duties unwanted by their senior counterparts because of their because on the fact that they were lower in the hierarchy. Next slide, please. Number 5 is unfair leave deduction. So in this section, we looked into whether the PRPs or the first year trainees, whether they have had their sick leaves deducted from their annual leave allowance to compel them to complete their training course within a year. Next slide. Preceptor training relationship. And in this section, we looked into whether the level of training experience of PRPs, was it consequence to a level of relationship shared between themselves and their preceptors. Next slide. So questionnaires aside, we also asked respondents for their feedback on 2 key concerns. The first one is performance evaluation by preceptors. Now, under this section, we sought constructive suggestions from the respondents on a common concern that performance evaluation under the current system is very subjective due to a fully decentralized marking system. Second. Next slide. A criteria for getting permanent posts. So under this section, we sought, again, constructive feedback from the respondents on the common concern that the criteria and selection process for permanent positions lack transparency. Next slide. Now, that comes to the end of the part one. So I'll now pass on to Theo to share with us about outcomes, feedback, recommendations, of course, our take home. To you, Theo.
A very good evening, and thank you, Cedric. So moving on from the questionnaire per se, we have come up with a few outcomes, feedbacks, and recommendations per se. Next slide, please. So getting from the feedbacks and from the survey results, we have been making a recommendation to the Pharmaceutical Services Program in the Ministry of Health Malaysia to re-emphasize a policy of the earned time off as per the current guideline on extra hour allowances by the Public Service Department. For your information, Malaysian pharmacists who are working extra office hours, extra hours, were not warranted to be given monetary allowances. So we are only allowed to claim time off per se. Hence, this is what has been done. We are also talking about, on top of that, it is also suggested that we should also illustrate the scopes and scenarios of what kind of pharmacy activities that qualify a pharmacist to claim for the extra time off or earned time off to provide clarity for all the concerned parties. Next slide, please. On the other hand, talking on the perceived lack of training opportunities for contract pharmacists per se, we have also made a recommendation to afford contract pharmacists with more training opportunities, despite the so-called concept saying that they'll be having a high turnaround time, a return of investment issue. We still believe that they deserve a chance to be trained equally. So in return, we suggested that why don't we try knowledge transfer to be carried out in the stipulated time frame after the training to ensure that learnings can be spread to all. Next slide. In terms of preceptors' quality, the inequalities, the competencies of preceptor per se, we would like to also call for a proper quality assurance system on the preceptors training, which has been feedback by our respondents as well. It includes a preceptor registry, a standardized training manual to streamline the tasks and approach required for preceptor while providing training in their respective fields, as well as a manual and periodical audits to ensure that the quality of preceptors were actually on par. In terms of the confusion over recruitment criteria, we also call upon to consider a more transparent evaluation system whereby we can see the scoring and weightage of each aspect used to rank and select the contract pharmacists for permanent appointments were made known to all. So in other words, we are looking for more transparency in this. Next slide. We also call for a two-tier evaluation in which the first was being the assessment performed by the preceptors at their training facility, and the second being actually a centralized evaluation after passing the first one, which is held through all the objective structured pharmacy examinations or paper-written examinations, as well as face-to-face interviews. We also call upon to improve the evaluation skills using logbooks, because as we can see from various types of evaluation methods. So one of it, which is more accurate and discrete, would be the behaviorally anchored rating scales, in which every point awarded to the trainee was well justified by different sets of skills and behaviors relevant to the perspective or the aspects that they have been looking into. Next slide. We also call upon to establish a secure channel to receive complaints and issues met by contract pharmacists in a direct manner. This is actually to avoid them, to avoid having the repercussion back to them while they're trying to voice out concerns on their training facilities without letting their superior know about that, because we were expecting repercussions which may affect their future. So we are looking for some very direct, secure channel that can avoid this in any possibility. Next slide. As a means to reduce man-made errors in the calculation of marks and percentage on their trainings, as well as to facilitate a more accurate and proper analysis of tracking and trending, we actually recommended to the authorities to consider adoption of an electronic logbook, whereby you can really reduce the probability of differences or miscalculations per se. So in a nutshell, we're talking about we're calling for improvement to reduce any potential bias. We're looking for further assessments to validate the capability of the preceptors, and we should actually looking for inclusion of peers and all module preceptors in their assessment, and looking for transparency. We'd like to also call upon the shoring up the quality of assessor of preceptors by establishing the training of preceptors and their monitoring. We also look into or call upon the acknowledgement of entitlements of our contract pharmacists or pharmacists on earning and claiming extra time off in a very fair and just manner. And last but not least, we are also calling for the proper recommendation and proper guidelines of fair training opportunities for all contract pharmacists with a proper knowledge transfer in it. So it basically wraps up our presentation today. Thank you very much from Western Malaysia.
Thank you very much, my dear colleagues, for the excellent presentation. I now have the honor to present the way forward and what we think is the best way forward to advance some of our survey findings. So based on our survey, we would like to propose 6 actions. Next slide. For the early career pharmaceutical groups, including the FIP-YPG as a way forward to increase the reach, the visibility, and the impact of early career pharmaceutical groups on global health, locally, nationally, and internationally. And I'll talk briefly about each of these actions in the next 6 slides. So the next slide shows that the need to, or the first action is to advocate the establishment of national and regional ECPGs. I am sure that everyone knows that unity is strength. The voice of emerging pharmacists and pharmaceutical scientist leaders can only be heard, amplified, and recognized effectively through a group that represents them. So through this survey, we identified many countries that do not have ECPG. So to assist the establishment of ECPG in March 2021, the FIP-YPG published a guide intended for use by any individual or organization planning to establish an ECPG in their region. You can see that figure on the left. If you would like a copy of that guideline, please get in touch with us at ypg@fip.org. It is only for internal circulation, so only for FIP members. The other figure shows an example of a digital event that we had as part of our work to support the establishment of an ECPG in Portuguese-speaking countries. So we can support pharmacists and pharmaceutical scientists who would like to develop ECPG in the region. So the next slide, action 2, we have also identified the need to increase engagement, global engagement and collaboration amongst national and regional ECPGs. So the FIP-YPG has a network. We started this about 2 years ago. So it consists of national and regional YPGs as a first step to build partnerships and collaboration and to foster engagement between and amongst the members. So at the moment, we have 16 national and regional ECPGs within the network. So the network, together with the results of the survey, will allow us to better tailor different support that we can provide to national and regional ECPGs that are based on their needs. And so in terms of action 3, we also highlighted some gaps in programs where early career pharmacists and pharmaceutical scientists can lead or contribute to, but which are not being conducted. So for example, 2 examples are areas where there seems to be a gap, as also highlighted in the survey results as well, presented earlier, primary healthcare and COVID-19 vaccination program. So these gaps really provides the opportunity to develop new programs led by ECPGs to address these critical public healthcare issues, and at the same time, potentially also expand the scope of practice of pharmacists and pharmaceutical scientists. The FIP-YPG, we have a subcommittee consisting of liaisons to all the different FIP sections and special interest groups. And we can definitely support the development of new programs. So action 4, we also highlighted some of the importance of generating evidence and promote collaborative initiatives. So our survey results highlighted that so many different initiatives conducted by ECPGs. And I think you've heard enough, but that we really promote you to read all the data that's being reported in a report that we will share shortly. So a lot of work that has been done, but prior to this survey being conducted, we understand that there was no work being done to collect this type of data. So it was quite difficult to demonstrate how we are contributing to global health. So we would support generation of evidence, for example, through this survey, and also FIP has this global pharmacy observatory developed and maintained by FIP. So the GPO and the data collected through this survey can help identify some gaps and also promote collaborative initiatives between ECPGs that have similar priorities. Action 5, we found that, so Cedric and Teo and Anggun has shared earlier that there are a lot of initiatives that are led by the ECPGs. So our launch event, we shared some of the survey findings. We had 3 speakers sharing some case studies in Indonesia and Malaysia. But these case studies also further highlight the important work that are currently being done in different regions. However, they aren't always very well promoted internationally, and we believe that ECPGs, we do deserve better recognition given that all the hard work that we put in to develop and implement all these initiatives. So in addition to publishing the report, we would also really like to promote all these activities on our social media platform, newsletters, digital events, and through our FIP network. The last action, action 6, I think few of my colleagues have previously shared that there seems to be a bit of mismatch between ECPG initiatives and members' expectations. So understanding the gaps and where national and regional ECPGs can better align their activities with their members' expectations and needs. So we will share the survey findings with ECPGs to point out this misalignment, so that ECPG can better tailor the future activities to support early career pharmacists and pharmaceutical scientists. I don't know if you can hear it, but it is a 1-year-old baby crying, and I'm sorry if you can hear it. So that's some of the suggested way forward. And so we started with Paul Sinclair, the chair of DPP, and it's really, we're really honored that we now have Raf, who is the chair of the FIP Education, and he's also at this event today. Raf, I would like to invite you to say a few words.
Hello, everyone. It's pretty early morning for me. I know it's various times of the day for everybody on this call. I apologize. I joined late. My alarm didn't sound, so I guess I was going to say something early on, but I'm happy to comment on the work that YPG has done in this effort and the report. So first of all, my congratulations to YPG, the editors of this report, the team that directed the project, the authors of the report, and the presentations today. I think it's a job well done. I'm continuously impressed with the activities of YPG and your ability to involve many members from around the world as accomplished in this study and in the report, so that we receive a true global perspective. This is an important piece of work, the first of its kind really, that provides us with insights into the efforts of early career pharmacists and organizations in addressing health issues in their communities, as well as taking on global health challenges, of which we know there are many. It's pretty clear that early career pharmacists and organizations are enthusiastically involved with many professional activities through numerous initiatives, as evidenced by the case studies presented here today and others that are in the report. So I want to thank you for tackling big global challenges. and launching this report that provides data and evidence to truly guide next steps on this continuous journey. And as you have found, there's always more work to be done. And as you proposed in the way forward, well thought out next steps to guide this continuous growth and development. Thank you also for inspiring our future generations to be full participants as both individuals and organizations in shaping the future of pharmacy and pharmacies and pharmacists' role as healthcare providers who improve health both locally and globally. And we see in the chat already people asking, how can I join and participate, which is absolutely terrific. And thank you also for reminding us who are parts of the older generations to always support the new generations, because that really creates a better future for all of us. So again, thank you very much for conducting this study and organizing it and reporting it to us today. And we look forward to what your future will be and your next steps will be. Well done and really good work. So thanks.
Thank you very much, all of you, for your kind words and your presentations. So before we pass to the panel discussion, I just want to share with you that the report will be made available on the August 12th. That's the International Youth Day, and what a better day to make it public. We'll share it through the email, and it will also be available in the website. So August the 12th, you may be expecting it. And now let's start our panel discussion. So we received some questions in our Q&A and our chat box, but you can still make some more questions. Please use the Q&A box for the questions you want to ask, or if you want to leave any comments. The first question we had in the chat box was regarding the where can I find more information about the African Young Pharmacists group and how to join in? And also received a similar question, and I want to direct it to Lucas. How can I start a young pharmacist group in our country, because we don't have it here? Lucas, can you please answer these two questions because they are related? Thank you.
Sure thing. We have different African so first for the African organization, so we have different African organizations. So it's not only for Nigeria, we also have other ones. And also we have one for Africa as a whole. So if you are interested in joining them, please enter in contact with us through ypg@fip.org. We can facilitate the communication for you. I don't have here in mind with me their contacts, but feel free. We'll be the ones dealing with that. And for those looking, not only for the one who asked, but for all of those who are interested in creating their own groups in their countries or in their regions, in their cities, though we, as you saw some slides before, we have a guideline for this, and we also provide direct support for those groups who want to start. So we can start we usually receive people from different levels. So sometimes just someone with the initiative, oh, I would like my country to have this, but they are alone, so they reach us, we can facilitate. Sometimes there are more people in FIP, YPG that are already there, we can facilitate the contact. And for those who we cannot do that, we surely can support with the guideline and with ideas on how to start. So we are looking for your emails on ypg@fip.org, and we can support you to join the ones that exist or to create your own organization. Thank you.
Thank you very much, Lucas, for your answer. I have another answer to Angun. How has youth contributed to the work of your organization?
Hi, Raquel. Well, it's such a tricky question because I'm being in the organization in the Indonesian YPG more than 5 years, and I can see ups and downs of the organization. Well, I don't know, it also happened to your national young pharmacists or not, but mostly people in our country, like probably happen also in other country, want to join the organization asking about the benefit, like maybe certificate or everything. But we here as a voluntary base. So first thing that we do at the beginning is we gather a force, a young pharmacist, a truly agent of change with like-minded, same vision and spirit. And from there is easily working together and make a contribution for the organization. And also from there, everything seems possible. That's why I'm saying this, because all the program that happen in Indonesian YPG is all because all the young pharmacists, we have a like-minded and same vision and spirit. So yeah, that's it.
Thank you very much.
Answer, Rico.
Great one. Really inspiring. And I think that's a bit why we are all here today. Now, I would like to ask Cedric, what are the challenges of the youth engagement in your organization in Malaysia?
Hi, Raquel. Thanks for the question. I think this question very much goes in line with Anggun's question, and I think she has summarized it very well. For us, it's about, most of the time, it's about getting more young pharmacists, we call it young pharmacists here, to resonate with what we do. And in order to attract more to join us, I guess it's very important that the value of our work, as well as the sort of purpose of our organization, is clearly communicated to the young pharmacists. And I guess it's very simple to start by just looking into setting the right focus internally within the organization. And then we are confident that what follows will be what is very much intended, the intended outcome. But speaking about internally within the organization, I guess we, as MPS YPC ourselves, we're making great strides in bringing more people into the organization. For example, in this term itself, we have had so many more members compared to the past terms. And I'm sure for the years to come as well, we have more members to join us. And then, for people in a leadership position like myself, then it's about making that experience not just enriching, not just providing them with that development opportunities, but also for young people, it's about that fun of being able to connect with each other, as well as that fun together. So that's what we try to do, and that's what I hope that the people that will come in next will continue to do as well.
Thank you very much, Cedric. That was also a nice answer.
Thanks.
Now I'd like to ask Professor Ralph, what do you think about our current youth generation and how can we be more involved?
So I think that, I think as pointed out in this report, you have some very, very enthusiastic young pharmacists and young pharmacist organizations. And I think what you've done here is taken the first step to involve more people. And I'm glad you've had such good attendance at this, because I'm sure you're influencing them to help join in the efforts. But I think it's very important for our early career colleagues to be certain to maintain your enthusiasm, maintain your optimism. There are many challenges out there for everyone. And it's really key to, and at times you'll be discouraged, but I think you've just got to maintain an optimistic point of view and always think of what the possibilities are for you going forward and for pharmacy and pharmacists in the world of healthcare. I know from our own experience that you get setbacks, but if you keep your eye on the goal, you'll eventually reach there. It takes time, it takes patience, it takes hard work, but in the end, it's absolutely worth it. So that would be my really my message is to remain thinking of what the possibilities are and the work you need to get there. And the road is not a straight line. It's up and down, it's torturous, it's curvy. I don't know, we have a saying, it's like, those aren't potholes in the road, that just is the road. And you just have to know that that's there and you work through it. And really, I mean, I see the enthusiasm here for doing that. So that's great. And just sort of to use a metaphor that's probably not really appropriate during the pandemic, but infect others with your enthusiasm. So thanks.
Thank you very much. I would also like to ask Dr. Paul Sinclair to share his opinion on this question, what our young generation can do to be more involved.
Thank you, Raquel. Yes, look, I think there's great opportunities. I'm at the other end of my career compared to most of the people on this webinar. And as I look back, I see that the scope for change that is in front of young pharmacists today is far greater than anything that I've experienced. There is enormous potential for expansion of scope of practice going forward for pharmacists to be actively involved in disease state management. In more advanced marketplaces, we'll see many more services provided in the home, and there's opportunities for pharmacists to be part of that. There is great opportunities for young pharmacists to drive the agenda, and I see that that's what you're in fact doing now with this report. This will be a great opportunity to leverage this report for some very strong advocacy work. And the role of both early career pharmacists and early career pharmacists organisations, you should never underestimate the influence that you can exert in fashioning the road in front of you. As Ralph said, it may have a few ups and downs, but it's a very dynamic industry, whether you're involved as practitioners in community pharmacy, as hospital pharmacists, as educators or as pharmaceutical scientists. There are enormous challenges, but there are enormous rewards in terms of professional satisfaction. So I think in terms of what you can do to become more involved is to stay engaged, okay, to try and influence the agenda. And groups like yours here today and the FIP YPG, that should be the nucleus of groups that then influence across continents and across all marketplaces. So I think what you should do is as Ralph said very correctly, maintain your enthusiasm and share that with others, because your strength is your numbers, and there are tens of thousands of young pharmacists, and I think that the opportunities in front of you today are enormous, and I just hope that you maintain this level of enthusiasm to capitalise on each of those opportunities.
Thank you very much for your support and your words. I would like to ask one final question to three different people to have three different vision points, to Diana, Renly, and Shirley. Diana as a member of the subcommittee, Shirley as a past president of YPG, and Renly as current president of YPG. What is the take-home, one take-home messages from today? What do you think? Maybe Diana, you can start.
Thanks, Raquel. I think the biggest message is that early career pharmaceutical organizations and early career pharmacists around the world are really trying to contribute to global health, and that's fantastic. And I think we need to be a little bit louder about it and share our successes with each other so that we all know what we're doing and we're all aware we're working towards the same goal. And then I think on top of that is the call for individuals to get involved. As Ralph and Paul just highlighted, the more people we have involved and the louder we are, the more we're going to get done. And every little bit helps. So I think it starts with getting involved, and that's how we make this bigger, and that's how we contribute to global health.
Thank you, Diana. Renly, you can go next.
Thank you so much, Raquel. I think I kind of share the same thought as Diana, and that was how I got involved with FIP. That was 4 years ago. I got involved. I had no idea what FIP was then. I still like to think that I know a bit more now. But really, I think every individual think that we're so tiny and we don't make a difference. But that's how really we started this project. The actual title initially was Making a Difference, how young pharmacists and pharmaceutical scientists can contribute to global health, because individually we can make a small difference, but together we can make such a huge impact. And as evidenced by this report, even though we only got data from 20 ECP, Early Career Pharmaceutical Organizations, we've already shown that they've done so much, and also illustrated by some of the case studies that we had. But a couple of years ago, when we did this collection of early career pharmaceutical groups around the world, we identified about 40, over 40, and I'm sure there are still more that we haven't identified. And we, as Lucas mentioned earlier, we've created the guideline. We're helping countries develop ECPGs in their world as well. So over the years, the amount of impact that we have is huge. So how do we evidence that? How do we illustrate that? I really encourage all young pharmacists and pharmaceutical scientists to get involved. Never feel like you're too small to make a difference, because we all can make an impact. And together we are really stronger. I would like to take this opportunity to advertise our YPG annual business meeting is upcoming on the 4th of September. If you would like to get involved, follow us on social media, and get in touch as well. If you need help, if anything at all, reach out to ypg@fip.org. We have a huge team of people. We have 45 subcommittee members and steering committee. We have our election coming up. There is no shortage of opportunities in FIP. There's so much to do, and we need a lot more people. So please volunteer, get in touch. We can all make a difference. Thank you.
Thank you, Shirley. Thank you, Renly. Shirley, you can go next now.
Thank you, Raquel. Actually, Diana and Renly already covered everything. I think also Paul and Ralph. What I just want to say, I would like to congratulate to FIP YPG and to all the teams who are involved in making this happen, making this event happen, and making the global report been launched. So thank you so much for your involvement. And of course, I would like to thank to you, Raquel, as well, to lead this project since last year until now, and finally we can make it happen. And as what Diana and Renly mentioned previously as well, working alone, it make us only make a small difference, but when we go and work together, when we work collaboratively, we can make like a really, really big difference, and I believe on it. So yeah, stay engaged with us and keep influencing others, because that's what we can do as well. So yeah, I think that's from me. Thanks, Raquel.
Thank you all. Also, I'd like to ask the same question to Theo, since you have different perspective from outside the FIP YPG. One take-home message, please.
Yeah, thank you very much, Raquel. I think in this pandemic era and post-pandemic, that we have been looking forward, and I mean, to the end of the pandemic per se, or even now at the moment, engagement is always a key for you to move forward. We have young pharmacists, early career pharmacists, we have the strength. We are living in the era of IoT, Internet of Things. We are living with a lot of mental and physical strengths, and this is where we have to utilize our strengths to lead the society, to engage with them better. I remember that Lucas shared that there are a lot of engagements by pharmacists with NGOs, but lacking in patient organizations. And this is the way that we should go forward. As in my country, Malaysia, where we are still lacking of dispensing separation, I believe that the engagement of early career pharmacists with the society, with the members of the public, is the key that actually can bring up and showcase our roles better in the future. So always keep ourselves engaged, as I agree with any of the panelists here. Thank you very much.
Thank you very much, Theo. And Fumbi, you're the last but not the least. Please share with us your take-home message. And just before that, a lot of people are asking if we give a certification. We don't, I'm sorry, but I hope you have learned a lot by hearing us. And if you have any other questions, please just let us know. Fumbi, you can.
Thank you, Raquel. I think everyone has said a lot. It's difficult to find anything else to add to that. But I think the one thing I would add is that for those who are involved nationally, locally, please keep doing what you're doing. Don't think that what you're doing locally doesn't affect the global landscape. It does. Everything that we do locally and nationally does come together on the global end. So, of course, everybody cannot operate on the global scale, but wherever you find yourself, just put your heart to it and try to make an impact wherever you are. That'll be a problem.
Thank you, and I agree with you and with all of that. All of you said. We are small if we are alone, but I think that with together and working together, we can achieve a lot of great things. And we have done it so far, and I think we can still work on it for the future. So I hope you learned a lot with this session today, and I hope that you got energized and motivated to do more for the future. And thank you everyone for joining. The streaming will be available and the report will come out this week on the 12th of August, International Youth Day. And I don't know if Shirley, you want to say a few words to end this?
No, Raquel, I think everything already covered. So yeah, I will hand over back to you actually to close the session. Should be fine. Thank you, Raquel.
Yeah, thank you all. Thank you again for being here. I think we can close the session some minutes earlier, and I really hope you appreciate it. Thank you, everyone, and have a nice day wherever you are. Have a great week. Bye-bye.
Thank you, everyone. Bye.